Hello, my name is Bill. I'm going to teach y'all today about hand hygiene and its importance in the field of healthcare, especially nurses. Y'all want to take a guess on what the estimated hand hygiene rates of nurses are?
100%.
Which one?
60.
60%. This close is 34 to 58%, depending on which study you go to. So there's three basic areas of hand washing. There's the antiseptic hand rub or wash, where you use something that's alcohol-based. A soap and water wash, where you obviously use soap and you lather up your hands and you use friction to get rid of any kind of microbes. And then there's surgical hand antisepsis, where you try to kill all the organisms. Surgical hand antisepsis gets rid of any transient microbes as well as normal flora that might infect the patient. So antibiotic-resistant organisms, as was, mine's a little bit different. According to my research, it'll kill 10 million people annually from now until 2050, I believe. The U.S. Department of Health and Human Services has deemed reduction of nosocomial infections or hospital-acquired infections as a priority goal. Research shows that hand hygiene is a proven strategy in preventing these infections. All right, so hand hygiene protects both the patient and the staff. It's very easy and inexpensive. You know, all you need soap and some alcohol. A little bit about the chain of infection. Obviously, there's the infectious agent, which is a microbe or whatever's on your skin. Then there's a reservoir, which is the place where the infection grows. It could be a bunch of different stuff. It could be humans, plants, animals, food, water, anything you come in contact with basically could be infected. The portal of exit is the method by where the infection leaves its host. This could be the GI tract, the respiratory tract, the genitourinary tract, blood, tissue, etc. Mode of transmission would be the vehicle. There's three different modes. Direct, which is person to person. Indirect, which is if you touch some kind of an object, like we talked about, such as food and water. It could be something on a table. You know, somebody else touched something who's infected that touched the table, then you touch it, and you take it wherever you go. And then there's airborne, which is like the flu that we talked about earlier. Could be transmitted airborne through droplets. So obviously there's a chain of contact, and that's the most important thing. It's the nurse's job to break the chain of contact, which is where we come in. All right, so the different techniques, as I spoke about earlier, is hand washing, which is lathering your hands, and you have to scrub vigorously to get all of the microbes off. This is from friction, basically, so the microbes fall off of you once you're rubbing your hands. And it doesn't kill the bacteria, but it physically removes them. Antiseptic wash or rub is mostly alcohol-based, and that kills a lot of the organisms that might be on your hands. Then, of course, there's surgical hand antisepsis, which kills most of the transient organisms, like I said earlier, in anything that you have, which is normal flora. The five main opportunities for nurses to wash their hands are before touching a patient, before a clean procedure, after exposure to any risk, blood, fluids, etc., after touching the patient, and after touching the patient's surrounding bed, table by bed, IV lines, IV pole, whatever might be close. Other things you might consider before or after entering the room, maybe even, as Hannah said, after you touch the doorknob and get out of the room, you might want to do it again. Before and after eating is important. You don't want to eat after you have something bad on your hands. When changing from a contaminated area on the patient to a clean area, obviously you want to deglove, wash your hands, re-glove. However, hand washing should never replace the need for gloves. Don't say, well, I'm just going to wash my hands after it'll be okay. That's probably not a good idea. Keep in mind too that hand sanitizer or something with alcohol It kills all the microorganisms, but it doesn't kill spores. Specifically, and there. I'll write that down. That'll help you. What's the one that's transmitted through poop?
C. diff.
C. diff. Write that down. Anyway, hand sanitizer does not kill spores, specifically C. diff spores. So you need to wash your hands after any contact with a patient with C. diff. And then obviously wash your hands if they're physically sore. Anything you can see. It's important to educate your patient and family also on hand washing, because any efforts you make will be nixed if they don't wash their hands. A few barriers for the hand washing practice. Malfunctioning equipment, if you have a sink that doesn't work, if you're out of soap, you can't wash your hands effectively. The most important though is time conflict. If you're in a rush, you got a lot of patients, I'll wash my hands later, whatnot. I read an interesting study though that I had not considered. Nurses, from this study, from the percentage nurses know that hand hygiene prevents infection, and they want to perform it, but they don't always do it. And this is based on the time constraint that I mentioned earlier. And so they suggested that instead of just teaching about the importance and why you should do it, and what it helps prevent, that you should act as a role model so they can see you do it. And that should help up the rates of hand washing. All right, I've got some handouts for you guys. They cover the 5 moments that I went over that are opportunities to wash your hands. Also, how an effective way to rub your hands with alcohol sanitizer, and how to wash your hands. So I'll get those to you. Back. My assistant Bridget is going to show you how not to wash your hands, if you'll be so kind. Thank you.
You're welcome.
Can anybody show me what she did wrong? Or tell me anyway?
I was here, my name is Anna, and I saw what she did wrong. So she came over here, she actually turned on the faucets, take her soap, was everything fine until at this point, but she just rubbed her hands together like 2 or 3 seconds, and after she turned off the faucets with her hands, direct contact, wet hands, she took the paper. So I think was everything like 5-7 seconds. That was not correct.
All right, so how long should you wash your hands for?
At least 20 seconds.
Or
singing happy birthday or something like that. You correct me?
2 times.
Okay.
Correct. All right, so I'm gonna show you how to wash your hands correctly. The first thing you want is warm water, not hot water, not cold water. Gotta wait till it gets warm. Happy birthday to you, happy birthday to you. Happy birthday, dear, whoever you are. Happy birthday to you. And then you rinse. Assistant. Dry. And then you can turn off the water with your paper towel. All right, so can anybody tell me why I would wash my hands instead of using hand sanitizer?
Yes, because you just took care of that patient with C. diff, and the hand sanitizer is not killing spores, so you need to wash your hands with hand and soap.
That's correct.
With water and soap.
You got it.
If you do that, your patients, they're gonna have many happy birthday songs. If you do like Bridget, they're not gonna be so many happy birthday songs.
That's
because
right.
they're gonna die.
Very good. Thank you.